Adrenergic agonists are a class of medications that stimulate the adrenergic system, a key component of the nervous system. It is therefore essential first to grasp the adrenergic system to understand adrenergic agonists. The adrenergic system comprises a large component of the sympathetic nervous system, a division of the autonomic nervous system. The autonomic nervous system, in turn, is part of the motor or efferent division of the peripheral nervous system. The adrenergic system plays a crucial role in the body's sympathetic nervous system, or fight-or-flight response, specifically affecting involuntary muscles, or those that operate without conscious control. This includes the cardiac muscles of the heart, and the smooth muscles found in blood vessels, as well as those in the digestive, respiratory, and urinary systems. When a stressor occurs, an action potential originating from the central nervous system travels to the thoracolumbar region of the spinal cord, extending from T1 to L2. This area is where the sympathetic nervous system and its preganglionic neurons originate. The action potential then travels along these preganglionic neurons, exiting the central nervous system at different spinal cord levels, based on their target tissue. Eventually, the preganglionic neuron synapses with a postganglionic neuron with the aid of acetylcholine. The use of acetylcholine as a neurotransmitter from the preganglionic neuron makes it a cholinergic neuron. The action potential then travels along the postganglionic neuron until it reaches its target tissue. The postganglionic neuron synapses with the target tissue with the aid of norepinephrine. The use of norepinephrine as a neurotransmitter from the postganglionic neuron makes it an adrenergic neuron. This norepinephrine then binds to adrenergic receptors found on the target tissue, stimulating a sympathetic nervous system or fight-or-flight response. There are two main types of adrenergic receptors, alpha-adrenergic and beta-adrenergic receptors, both of which have subtypes. Alpha and beta adrenergic receptors differ in location and therefore function, but ultimately produce a sympathetic nervous system or fight-or-flight response. Alpha-adrenergic receptors have two subtypes, alpha-1 and alpha-2 adrenergic receptors. Alpha-1 receptors are primarily located in the smooth muscles of blood vessels and the bladder. When stimulated by norepinephrine, these receptors lead to vasoconstriction and the contraction of the urinary sphincter. On the other hand, alpha-2 receptors are primarily located in presynaptic nerve terminals. When norepinephrine stimulates these receptors, it causes feedback inhibition, which reduces the release of norepinephrine from the presynaptic neuron, resulting in central nervous system depression. Beta-adrenergic receptors have three subtypes, beta-1, beta-2, and beta-3 adrenergic receptors. Beta-1 receptors are primarily located in the heart. When stimulated by norepinephrine, these receptors lead to a positive inotropic and chronotropic effect, meaning the heart's force of contraction and rate increase. Whereas, beta-2 receptors are primarily located in the lungs and uterus. When norepinephrine stimulates these receptors, it causes bronchodilation and uterine muscle relaxation. And beta-3 receptors are primarily located in the detrusor muscle, or the smooth muscle in the bladder wall, responsible for contraction during urination. When stimulated by norepinephrine, these receptors lead to the relaxation of the detrusor muscle. Adrenergic agonists stimulate the adrenergic system, causing a sympathetic nervous system or fight-or-flight response. Due to this, most adrenergic agonists are considered sympathomimetics. Adrenergic agonists stimulate the adrenergic system in three main ways: directly, indirectly, and mixed action. Direct adrenergic agonists directly bind to adrenergic receptors, stimulating them, whereas indirect adrenergic agonists stimulate the release of norepinephrine, which then binds to adrenergic receptors, causing stimulation. And mixed action adrenergic agonists, both directly and indirectly, stimulate adrenergic receptors. Examples of direct adrenergic agonists include alpha-1 agonists, such as phenylephrine, alpha-2 agonists, such as clonidine, beta-1 agonists, such as dobutamine, beta-2 agonists, such as albuterol, beta-3 agonists, such as mirabegron, non-selective beta-agonists, such as isoproterenol, and non-selective adrenergic agonists, such as epinephrine, norepinephrine, and dopamine. Examples of indirect adrenergic agonists include amphetamine and amphetamine-like drugs, such as Adderall, and monoamine oxidase inhibitors, or MAOIs, such as phenelzine. Examples of mixed-action adrenergic agonists include pseudoephedrine and ephedrine. If you want to learn more about any of these medications, you can click the link on screen or in the description below. I hope you found this video helpful. If you did, please let me know by giving it a thumbs up, subscribing, and leaving a comment below. Thank you, and bye!